Did you just get a bad Pap result and you are very worried? Is that why you're here? Well, please stay so I can give you important information about how to help you through this. Welcome to Women's Healthcare Answers, and this is Jeff McQueary, a Tennessee gynecologist. I want to focus on you, especially if your gynecologic problems are dominating your life and you want to take back control. You can solve your problems with answers and solutions I will give you. You need this information today about screening for cervical cancer and the why and how we screen with Pap and HPV tests. Stick around to the end to understand what I am looking for and how you should be treated. The Pap and HPV tests are for screening. So what is the definition of a screening test? That is a test that checks for a disease or condition before symptoms ever appear. So we might be able to find diseases at an earlier stage when it's easier to treat or might even be able to be cured. In the case of cervical cancer, that is the whole reason we do Pap and HPV testing, to make sure we find your problems early and get them treated. But how do we do Pap smear screening? Well, number one, there's no screening before the age of 21. And I'm sure you're glad to hear that. But the reason is that cervical cancer is extremely rare before the age of 21. Even with sexual exposure to HPV virus, progression to precancerous or cancerous changes is very slow. The immune system is strong and is able to fight back the HPV virus, which is the biggest cause of cervical cancer. Also, treatment of precancer in this age group could lead to some bad pregnancy outcomes, especially with potential scarring of the cervix. So for these reasons, there is no reason before the age of 21 to do any screening. And we only do Pap tests between the ages of 21 and 29. So even though HPV infection is common in this age group, these infections usually go away on their own within a few years and do not cause any lasting changes in the cervical cells. Screening tests such as HPV and Pap tests together have a high false positive rate, especially in this age group. So it's best for doctors not to overly worry you, so we try to not do these tests together in that same time period. But in the group 30 to 65, we can do any of three testing strategies. We can do just the Pap test alone every 3 years. We can do HPV testing alone every 5 years, or we can do tests together. And this is what is called co-testing, doing HPV and the Pap test together every 5 years. So in this age group, all three methods provide reasonable benefit without the high risk of needing unnecessary tests due to false positive results. What is a false positive? It's when you get an abnormal result, but you don't have any abnormalities. But the false positives still can happen despite our best efforts. Now, age group greater than 65, which is typically the Medicare age, you don't need a Pap any longer if you've had at least 3 normal testing cycles. But that's kind of sometimes hard to figure out, so an easy rule of thumb, and what I typically say, is you can stop if you've had normal Pap smears for 20 years. So you're 65, normal Pap smears for 20 years, no more. Now, if you have not had any recent Pap tests or just don't know if they've been normal or not, you probably should continue screening. But if you've had severe precancer or cancer or an immune system that's really weak, then I would definitely continue Pap smears as I have recommended before. But remember, Medicare will pay for a Pap every 2 years if you need it. So the last category is a common one. If you've had a hysterectomy with removal of the cervix, there is probably very little benefit to continued screening with Pap tests. But if you've had severe precancer or immune problems such as HIV, even just still with having only a vaginal tissue, this may still be appropriate to continue those Pap tests. So here's the thing. Cervical cancer has really decreased since the 60s when Pap tests became widespread, so it shows that the screening tests work. But there is still over 4,000 cervical cancer deaths each year that could really have been prevented, and that is what we're looking for. That's why we do the testing. So if you like this video so far, hit the like button. It really helps with YouTube, and please subscribe, because if you miss any of my new medical videos coming out every week, who am I going to talk to? Just give me a thumbs up and please comment. So back to the information you want. What are doctors looking for in a Pap test? So we're looking for cells that have been scraped off the cervix that are not quite normal. So these cells are what we call either atypical, low grade, high grade, or even cancer. Atypical is a very minor change and typically not a big problem. You may see this on your Pap as atypical squamous cells of undetermined significance, or ASCUS, ASCUS. Just to understand, you may even have access to your Pap results before your doctor has seen it. So don't panic. It's important for you to understand the risk of each problem. The next level is low grade, which gives a slightly greater risk of cell change. You can see it listed as low grade squamous intraepithelial lesion, or LSIL. This is a grade up from ASCUS, ASCUS, but still not typically severe yet. So the next is high grade, a much greater risk of precancerous cells. You will see this as high grade squamous intraepithelial lesion, or HSIL, typically associated with the highest risk HPV. Then, of course, cancer can also be diagnosed by a Pap test as well. But it's most important to know that these previous diagnoses are just based upon looking at cells under a microscope by a cytopathologist. This is a doctor that specializes in looking at and diagnosing cell problems. But they need tissue by biopsy to give you the best diagnosis. Your doctor is typically going to decide how to diagnose your Pap results based upon several criteria. If it's ASCUS, ASCUS, and negative HPV, you will get a repeat Pap smear in 1 year. You will get a colposcopy if you have ASCUS, ASCUS, or LSIL with positive HPV, also HSIL or cancer. So what is a colposcopy? A colposcopy is when your gynecologist, your doctor, looks at your cervix with a microscope and takes biopsies if they see abnormal tissue. The tissue they get then goes to the pathologist, who is the doctor who makes a final diagnosis. But what does your doctor do with the final diagnosis? Never fear, your gynecologist is very knowledgeable in treating all these problems. The good thing is, there is the possibility after all this testing, you will only need a repeat Pap test in 6 months to a year. But if your doctor feels it would be in your best interest, they will remove the abnormal cells so you can be free of them. They remove the cells by freezing, called cryotherapy, electrical loop, or laser, and these are the most common. And if it's appropriate, even a hysterectomy is a consideration, but it's not a common treatment. Please, I don't give you any of this information to worry you, but just to help you understand how important it is to get your HPV and Pap screening. My hope is, if you get your HPV vaccination and keep up with your screening, you may never have abnormal Pap tests ever again and never have to go through any of these treatments. I just really wish you the best. And hopefully you feel you've learned something. And as always, I've enjoyed being here with you. I would love to help you solve your problems at Women's Healthcare Answers. Remember, this video is meant for information purposes only. Please consult your own healthcare provider, but it's okay to reference the information I gave you.